welcome to our training today. I am Jackie Tewes, owner and founder of Flourish Medical and Wellness. And today I'm going to walk you guys through a quick training on how to interpret your InBody body scan to better understand body composition, overall health, and how to achieve those wellness goals. So I have an example pulled up here that we will work our way through. And I'll just touch on these high level points so that you guys can get a pretty good understanding interpreting your own. If you have specific questions regarding your specific readouts and your numbers, please set up something with your provider to go through these in detail. The scan really gives us a lot of information about kidney function, inflammation, swelling, cellular health, a lot of things, but we're going to just touch on high level how to interpret this on your own, how to read it. So I'll kind of explain that to you. It is super helpful to have a starting baseline read and then also to see repeat scans to really track your progress and then make any tweaks to what we're doing. Maybe it's dietary changes, it could be activity changes, weightlifting changes, those types of things. So make sure, again, if there's anything specific for you, that you do reach out to your provider to go over those if you have more questions and more details. So the first thing you will see here on my screen is you're going to see the first section called the body composition analysis. So you'll see this is broken down into intracellular water, how many pounds of that, how many pounds of extracellular water, how many pounds of dry lean mass or muscle mass, and then how many pounds of body fat mass. So those are all listed out for you in pounds. Here you'll see the total weight of the person or your test, and again, total pounds of fat-free mass and total body water. So that is your first section. Just a quick snapshot. Below that, you will see what we get into as our muscle fat analysis section. So this is breaking down, again, weight, skeletal muscle mass, which is the SMM, and your body fat mass. Now, there's two important things to note here. You will see over here in the corner this percentage sign. So these numbers across the top, 55, 70, 85, 100, those are referring to the percentage of the top line. And then the bottom where that bar is, that is referring to pounds. So what you need to know is that 100% mark, where that dash line is between the 85 and the 115, that is where the average healthy female or male, so depending on your gender, of your height should be. So remember, the InBody scans are only comparing you to other men or women, so same gender and same height. So that's what we're looking at. We're not looking at age. We're not looking at nationality, any of those things. It's just looking at height and gender to give you where those levels should be. So that dash mark between the 85 to 115, that is where the average healthy male or female of your height should fall. Really right at that 100% is where we want you to be. So in this example, you'll see that her bar goes between the 130 to 145. So let's call it 140%. So this individual is has 40% a higher weight than her average should be. So she would want to lose about 40% of her current weight. Her current weight is 165 pounds. Then we look down here at skeletal muscle mass. Same thing. So you'll see that her muscle mass is 51 pounds, which is great. And she's falling right in that about 100, a little bit over 100. So she has a good amount of muscle mass for her height and her gender. Then the bottom one is the body fat mass. And so you'll see here, she has 69 pounds of body fat, and she is at 340%. So that means she is 240% more in body fat than the average healthy female of her height. So that is how you interpret these. A very quick thing to look for in this muscle fat analysis section is you'll see that these three bars make the shape of a C. Okay. What we would like to see is we would like to see them either more of an I shape in this 100 range, or a D shape where her muscle mass or the muscle mass is longer, and the weight and the fat mass are shorter. So it's making more of that D shape. So that is how we interpret that muscle fat analysis section. Below that, you'll see the obesity analysis. So for the obesity analysis, you're going to have your BMI, body mass index, which we know isn't a great number for us because it doesn't take into consideration fat mass. We're still calling it out here. And then the percent of body fat. Okay. So this is important for women. Women should be about 18 to 28% body fat. Is that, again, ideal for their height and gender? For men, that's about 10 to 20% is really where we want to see that percent body fat landing. So for this individual, we would want her to lose quite a bit of body fat to get her body fat percentage down into that healthy average range in that 18 to 28%. Okay. The next section there is going to be the segmental lean analysis section. I really like this section because it gives us a lot of really great information. So you'll see this is broken down into right arm, the trunk, the right leg, and the left leg. So the very first thing we're looking at here is, are these bars similar in length and where they're landing? So again, we want that I shape. What you'll see in this person is that their arms, their bars extend further than their legs. So let's look at this. So again, the top number is reading pounds. So this person has 5.27 pounds of muscle in their right arm and 4.93 pounds of muscle in their left arm. The percentage in this section is telling us whether or not the muscle strength is enough to support that person's weight. So we want that to be 100 or greater. So in her arms are strong enough to support her weight. If you go down here to her legs, what you're going to see is she has 13.3 pounds of muscle in her right leg, 13.38 pounds of muscle in her left leg, and 87%. So this means she's below that 100%. So she does not have enough muscle mass in her legs to support her frame, her weight. So when I look at this, the first thing I see is we need to increase lower body strength. So really setting up workouts that are focusing on increasing lower body strength is going to be key for this individual. The other thing that we see here is the trunk. So her trunk lean analysis is pretty good. And then it's a little bit higher than what we would maybe like to see this. And so really just getting this whole section in more of an I shape is what we're shooting for. Just for some reference, again, this is where a little bit more of that individualized planning could come in. But we really don't want to see more than a 6% difference between the arms, and then a less than a 3% difference between the legs. So this person is at 87 and 87. If it was at 87 and 80, that would be a significant change in leg strength that would make us question what was going on and want us to do some deeper digging in that. I think that's the main parts for that. The next section down there, the ECW TBW, this is looking at our phase angle, or really looking at our extracellular water versus our total body water. The goal here is to really keep this around 3.39 or less. When we start getting up higher, that tells me we have inflammation going on, and we need to be alarmed and aware of, hey, what's causing this inflammation? And again, do we need to do some more digging into this? The higher the ratio, the more inflammation that there is, and that can be due to muscle loss, that could be due to injury, that could be due to overuse. So again, a really helpful tool for us to know what's going on inside the cells. You'll see this phase angle over here toward the right. Men should be somewhere between 5 to 7, ideally, and women should be somewhere between 4 to 6. And this is telling us about the overall cellular integrity. So how strong are the cells? Down here in the bottom, you're going to see a composition history. So once this person has more tests, it'll plot them and measure them. Is our weight going up? Is our weight going down? Are we losing muscle mass or gaining muscle mass? Is our body fat percent going up or down? And then what's happening with our total body water and our extracellular water? Over on the right, what we will see is an InBody score here up in the top corner. And this is really specific to InBody. And they just have a kind of total score that's super easy for us to look at and say, hey, how are we doing? Is our score getting better or worse? The ideal score here should be around an 80. The next section that you're going to see here is your skeletal mass index. And this is really looking at how much, um, what is your skeletal mass index to support functional movement. For males, we want to see that over 7. And for females, we want to see that between 5 to 7. And this is how much it helps us understand if we have enough to maintain functional strength. So doing your everyday activities, bending, squatting, stairs, all of those types of things. And below that, you're going to see your body fat or fat-free mass. So as you can see, these are recommendations to help us bring this fat analysis section into a better D shape or I shape. So the recommendation for this person would be to lose 41.2 pounds of fat mass, and our muscle mass is pretty good. So we would want to kind of maintain that muscle mass. Doesn't necessarily need to put on more muscle mass, but maintain. But we do need to lose about 41 pounds of fat mass. Below that, you'll see the segmental fat analysis. So this is specifically looking at fat. So the right arm shows that it has 5.7 pounds of fat, left arm 6 pounds of fat. And so again, this middle section here where this dash mark is 100%. So this person is 182% more fat in her right arm than the healthy average woman. So we need to lose some fat in the right arm, would need to lose some fat in the left arm, would need to lose significantly more fat in the trunk, and then some as well in the right and left leg. This is another good place to help us understand whether or not our fat mass, our muscle is evenly distributed and where we want to focus activity and workout plans. Below that, you're going to see your visceral fat. You'll see here 10 is right in the middle. That is our ideal. So the visceral fat level should be 10 or less. Visceral fat is that fat around the organs that puts us at increased risk for metabolic disease issues like stroke, heart attack, insulin resistance, diabetes, those types of things. So we can't really necessarily see this physically on the outside. So having a reading of this is really important and making sure it's around that 10 or less. This person is at a 17, so that's what that level 17 is referring to. Below that, you'll see basal metabolic rate. So this is telling us how many calories at rest this person will burn every single day. And so we also want to look at this to make sure that we're getting at least that number of calories to continue to support muscle maintenance and muscle growth. The more our muscle mass goes up, our BMR, or basal metabolic rate, will also go up, and the vice versa is true as well. Opposite is true. So if our muscle mass goes down, that number will go down as well. Those are the big kind of key pieces that we're looking at when we're interpreting these. Like I said, if you are able to have multiple tests, I usually recommend every couple weeks, every 2 to 4 weeks, depending on your workout routine and your activity and your weight loss plan. But that really helps us track and to know where do we need to focus our workouts, what should our goal weight loss be? Do we need to put on fat or do we need to put on muscle, or do we just need to lose fat? Do we need to do a little bit of both? What should those calories be? And so it's a really great starting point And even if you are in the middle of workouts and you've been working out for years or months or weeks, and you want to know, okay, how do I continue to progress and make sure I'm getting the most out of my workouts? This tool can be super helpful. So if you have any questions, reach out to us here at Flourish or check us out online, socials at Flourish Medical Wellness or flourishmedicalwellness.com. Thank you. Have a great day.